Every year, influenza kills about 30,000 people in the U.S. That's according to Dr. Raj Naik, who says it's especially important to get the influenza vaccine this year.
People that will have symptoms that are indistinguishable from the coronavirus is significant, so it'll make it just more complicated to sort out who has influenza and who has COVID.
Naik says it will most likely become regular protocol to test for each.
Of course, we have testing for each, but it just taxes the system more. Secondly, that is the big issue is if we have a big epidemic of influenza on top of what we're dealing with coronavirus, it could really tax the resources that hospital systems have.
Of the 10 people we talked to in downtown La-Crosse, all say they plan to get the flu vaccine, regardless of the pandemic.
I've always thought that vaccinations are really important. If you look back through history, smallpox, measles, polio, those are things that are only being eradicated or are eradicated by vaccines.
I would get the flu vaccine anyway, even if it weren't for corona, but definitely will get it.
I think it's particularly important to get a flu vaccine in these times of the coronavirus. I think we want to protect ourselves as much as we can against any kind of infection.
And Naik says it's also especially important to get the flu vaccine this year because of a new swine flu strain.
It has the potential, since it is a mutation that is new in this type of strain, to cause problems and has some potential to cause pandemic-type illness.
But to help stop the spread of any illness, including COVID, Naik says to follow CDC guidelines.
And one of the interesting things that we were able to see with the physical distancing and the stay-at-home orders that happened in March is we were still having a high burden of influenza disease. And as soon as we stayed at home and started washing our hands, this was even before the face coverings, the influenza illness quickly dissipated.
In La-Crosse, Isabella Holsizer, News 8 Now.